Yeah, I would like to welcome you all. This is our forum. We are going to have a forum which has been hosted by the Deloitte Tanzania. But before we start, I would like to welcome Dr. Marina Jelekela, who is a Chief of Part, Deloitte Tanzania. Will you please give a clap to Dr. Marina?
Thank you very much, our moderator, Dr. Mfanga, Regional Medical Officer Njombe. We really appreciate for accepting to be our moderator for this session. I would like to welcome you all in our Deloitte forum this afternoon. Because of time, I just want to mention that Deloitte is very much experienced in implementation of health programs, and we have started more than a decade ago, and we have several programs which we have managed, including Tunajali 1, Tunajali 2, these were HIV, AIDS care and treatment programs, but also we had a rapid funding envelope, which was giving grants to CSOs, but also we have a BOCA, which was about capacity development for these CSOs, and we went on for 2 huge USAID programs, USAID Boresha Afya Southern Zone and USAID now Afya Yangu Southern Zone. So the organization has been growing in terms of capacity and ability to implement health programs, and you will see the impact ever since to the moment. Karibu Dr. Uendelee. Thank you so much. Karibuni sana. Let's go through this together.
Please give a clap to Dr. Marina once again. Yes, my name is Dr. Juma Mfanga, Regional Medical Officer for Njombe Region, but also a head of health, social affairs and nutrition. I'll be moderating this forum, and before I start, I would like to introduce one thing, that this forum has been organized and hosted by Deloitte Tanzania. And for those who are not aware, Deloitte is managing implementation of 2 health programs in Tanzania for USAID Tanzania. And these are USAID Afya Yangu Tanzania and USAID Kizazi Hodari Southern Activity. So with support from the PEPFAR and the USAID, Deloitte has organized this forum. As we can see, our theme is making the impact that matters, sustainable HIV response for healthier lives and thriving communities. Just to showcase the experience in deep dive where the delivering of sustainable HIV response in southern Tanzania. So we're going to have the panelists. We have 6 of them. I'll call them later on. And they are going to share and explore the experience, a practical experience from the field, the basic practices, the lesson learned in HIV services delivery integration, community-led responses, and efforts in enhancing local capacity for sustainable HIV response. So without wasting time, may I call upon the first speaker, who is Nafika Hedi Mboya. She is a Results Management Officer. Have a seat, please. She is a Results Management Officer in Kizazi Hodari Southern Zone Activity. Nafika Hedi is a accomplished public health specialist with a background in biomedical sciences. But she's also more than 10 years passionate about promoting gender equality and challenging gender normative roles. Her expertise in governance and women's sexual reproductive health has been instrumental in empowering the young women in rural area of Tanzania. So she's going to share with us the program overview for Kizazi Hodari program. The second speaker is Dr. Albina Gerege. Welcome. Dr. Albina Gerege is a regional program manager for Lane region and Afya Yangu Southern. She's a public health specialist, medical doctor for more than 13 years. She has a lot of experiences in managing and delivering the integrated client-centric HIV/AIDS interventions, both in the community, but also in the facility level. So, Dr. Albina brings a rich experience in working directly with her clients and beneficiaries in the field. She is going to provide with us the program overview for USAID Afya Young Thousands and highlight a little bit on the journey towards sustainability and the USAID Afya Young Thousands, as well as she will talk a bit on sustainable HIV response, a key drivers in the local context. The third speaker is Dr. Rehema Msimbe. Come forward, please. Rehema is a manager, care and treatment in USAID Afya Young Thousands. She is a public health specialist, over 13 years old, and she is a public health, she is extensive experience in public health interventions, particularly in the HIV treatment, TB, maternal child health, cervical cancer prevention, and family planning integrations. She's a member of family planning, cervical cancer comprehensive adult care treatment, national technical working groups. Give a clap, please. A member of differentiated service deliveries, DSD task force. So she is going to tell us the integrated approach in HIV service delivery under USAID Afya Young Thousands. The fourth speaker is Abubakar Rehan. Mr. Abubakar Rehan is a manager of gender youth focused care in USAID Afya Young Thousands. He is dedicated to gender equality, youth, social inclusion for more than 15 years, extensive experience in promoting sexual reproductive health and rights, gender equity and equality, and implementing youth and women empowerment programs. Mr. Rehani will share experience in mainstreaming gender and youth intervention for sustainable HIV epidemic control. The last two speakers, Mr. Yangu, will you please welcome? Mr. Yangu is a technical and quality improvement in Kizazi Hodari Thousand activities. Yangu is a accomplished public health professional, has more than 10 years experience in community-based HIV interventions, gender-based violence interventions, sexual reproductive health and rights, education, math, sexual programming, in livelihood interventions. Mr. Yangu will share experience in sustainable impact through next future generation in orphans, vulnerable children program. The last speaker is Dr. Frank. Dr. Frank Kimganga. I have to declare the interest. He is one of my council medical officer. He is from Jombe District Council. He's also a public health specialist for 13 years old. Mr. Mganga is highly innovative, proficient in strengthening quality of health care, and key players in provision of the TB, HIV, reproductive maternal child health services. He has been instrumental in creating and managing streamlined client-centric HIV program in the country. And he is going to tell us how so far has been dealing with community engagement, specifically in the HIV services. So I would like to welcome you all. Just to start, Dr. Gerege, can you tell us a little bit how so far have you prepared towards the journey to sustainability? As you know, this financial year, the very new financial year, we're going to start the journey to sustainability. You're welcome. You have 10 minutes.
Hello, good afternoon. So USAID Afya Yangu has the desire to make sure that the programs are owned and led and maintained. So the first process that we have done is the formation of sustainability structures, and these are the Journey to Self-Reliance task forces that are formed from 6 regions that we are supporting: Iringa, Njombe, Mtwara, Ruvuma, and Lindi, also Morogoro. And another strategy is the sustainability of the capacity assessment. The Journey task force created to do assessments if they are capable, and these are formed by mixed people from community, from health facilities, from the governance, RAS office. And another step is the development of the sustainability strategies to make sure that we build capacity of resource mobilizations to make sure that people are ready to take off the programs, and to make sure that there's a continuity of service provision, quality, comprehensive, integrated service provision in HIV and TB, same for the same quality as when the project existed. And the last one is execution of the sustainability initiative. And this mainly will be done by capacitating the CCHAP to make sure that the regions, the councils are incorporating HIV activities in their budget. And this is also be led by, if we have policies and guidelines to make sure that the priority of HIV, TB, family planning, integration activities are taken seriously as much as other activities in the facility level. Yeah.
That is very wonderful. The RHMTs and CHMT are very waiting for that. Thank you very much. Nafika Hedi Mboya, we are very aware that Kizazi Hodari Southern Zone activity has done a lot, especially in the area of orphan and vulnerable children. Can you please share with us an overview of the program, specifically Kizazi Hodari program?
Thank you very much. Good afternoon, everyone.
Yes.
Okay, once again, good afternoon, everyone. I'm very pleased to be introducing Kizazi Hodari Southern Zone activity, a remarkable 5-year USAID community-based initiative that is really transforming the lives of orphans and vulnerable children across Tanzania, but also playing a pivotal role in driving progress towards the achievement of the 95-95 UNAIDS goals in the fight against HIV and AIDS. We started our implementation in March 2022 with the primary focus of improving the health, well-being, and protection of orphans and vulnerable children, as well as youth and OVC caregivers, particularly in regions where they are burdened with the HIV pandemic. Now, Deloitte, as the prime implementer of This initiative implements through civil society organizations, and these civil society organizations have the duty and responsibility of overseeing and managing our dedicated community case workers who are really at the epicenter of service delivery at the household and community level. We're currently in our 3rd year of implementation, and for the initial 2 years of implementation, we covered 5 southern regions, which are Iringa, Njombe, Ruvuma, Lindi, and Mtwara. But I'm pleased to share with everyone that as of October 2023, USAID has expanded our scope, adding an additional 6 regions. So we will be impacting and serving the OVC in a total of 11 regions and covering 44 councils. So Kizazi activity has 3 main objectives, and our first objective is really geared towards achieving the 95-95-95 UNAIDS goals. And for the first 95, we are focused on case finding. We work very, very closely with our clinical partners to ensure that through HIV testing, but also we play a pivotal role in mobilizing beneficiaries for index testing so that we can ensure that there's no child who is left undiagnosed. Now, for the second 95, for all the children that are diagnosed HIV positive, we have a duty to make sure that they are on treatment, as well as we offer socioeconomic support to ensure that they are adhering to treatment and also are retained in care. Now, for the third 95 as well, we focus very much on ensuring that the children that are on treatment are virally suppressed. And again, we work very closely with our clinical partner, Afya Yangu, to make sure that we monitor the beneficiary viral load. And we also offer OVC, specialized OVC service delivery package for those beneficiaries who are struggling to achieve virus suppression. So the package will include things like nutritional support, psychosocial support, as well as economic support as well to ensure that we achieve virus suppression. And we also recognize that the vulnerability of the age group in which we serve. The beneficiaries between the age of 0 to 18, they're very vulnerable and at risk to violence and abuse, as well as early pregnancy and sexual transmitted diseases. And so for us to ensure that we safeguard this group, as well as protect this age group, we are keen to ensure that they have access to HIV prevention services, violence prevention services, as well as responses. So this is a nutshell which covers objective 2 for our program. And for the third objective, which is the final objective, I just want to say that it really focuses on addressing the critical issue around household sustainability. And so we also offer economic strengthening services for our beneficiaries and the OVC caregivers to make sure that that household is sustainable to serve the beneficiary needs. Thank you very much.
Yeah, well spoken. Can you give a big clap? Just to tell you, if you're not aware, Nafika Hedi in one of the native local languages reached a better place. So, Dr. Marina, Deloitte or USAID might be a better place. May I call again, Dr. Geregi, can you tell us, once you talk about sustainable HIV response, what are the key drivers in just a local context? Can you tell us more?
Thank you for a very... Yes, so the response, the key drivers from the local context starts from planning and coordination. We make sure that there's inclusion of HIV interventions in the regional councils and facility level. Also, there's stakeholder engagement to make sure that we include all the implementations in engagement of strategies in HIV service delivery. Another one is community-led HIV response. This is the feedback system from the service recipient of care or beneficiaries, whereby they tell us about the service provision, the quality of services, how did they see the service provision, were there long queues, were there the tests, do they know what tests are taken for them? So this is the inclusion of the people living with HIV in HIV care and treatment services. We also have a domestic approach. This is optimizing domestic approach in sustaining HIV response. And this mainly is from national level, inclusion of activities or like, for example, AIDS trust funds to make sure that the resources are mobilized. We also have policy and guidelines. If we talk about sustainability, but we don't have policies and guidelines in place, we won't be able to achieve what we are looking for. So also HIV service delivery integration. Like I said before, our project mainly is integrated comprehensive service delivery. When someone comes for ART and has maybe a need of family planning services, we don't need to refer them. We have a one-stop shop, make sure that all services are integrated in the same platform or same unit. Also, HIV capacity development. If we talk about sustainability, we have to build capacities of the local government authorities, from regional health management team, council health management team, to make sure that they are very much aware of the activities as well as the planning and the budgets and the implementation. Like I said before, we have to integrate. We start implementation in FY3 and 4 to make sure that some of HIV activities are integrated in council health management plans and budgets. Yeah.
Thank you very much, Dr. Albina. Dr. Rema Msimbe, I know you are very well experienced in integration. Can you please share with us how integrated the approach in HIV service delivery and USAID Afya Yangu has done so far?
Thank you very much for a great question. As I've mentioned, my name is Dr. Rehema, and I work in a technical capacity with the USAID Afya Yangu for service delivery and care and treatment services. And we cannot talk of sustainability without to have the ability to support the process. So we continue to achieve the same quality services, even when the donor funding, we are at a reduction side, and we have to build the capacity of our providers to offer comprehensive and integrated services at our facilities. So these best practices that we want to share with you thrives to offer establishment of affordable but offer locally led comprehensive services. And we know by integration we meet client needs comprehensively with all the required services that we can give. So for us, we integrate from identification. We have providers that we train them. We have providers that we train them for index testing, optimized PITC, but more innovation are coming for identifying them when they are at the sanctuaries, as we know that closing the gaps, the clients are not easily reached with the generic services that we've been providing. So now we are engaging them, the provider that we already trained. We engage by offering comprehensive services like scaling services through mentorship. We have mentored them in the social network testing that we can engage our SBCC component with the chair. We have these champions who are recruiting the less reached age band of 15 to 24. So the champions can recruit their social counterparts so that we can reach them in identification. We can reach them at the community, but also we can reach them at the facilities. This is a way that the funding for didactic trainings are reduced, but we can use the available SBCC models, but also we can train the providers so that they can scale up this activity through mentors. But also at the care and treatment services, we want to capacitate the providers. This recipient of care, when they come, they are screened for hypertension, they are screened for cervical cancer screening, they are offered counseling for family planning services, but also they receive their ART services. So for this, we see a biggest impact because this provider, we capacitate them with across the board efforts so that they can reach this and reducing the barriers for services, because they should not go to the hypertension clinic, family planning, and this is not for sustainability is all we are talking. But also we know that the funding are reducing and we want to have the National AIDS Trust Fund, but at that time, until it is fully-fledged, we need to work very closely with our RSHMTs and CHMTs and HMTs so that they own these services prior to reaching the owning us and have our own budgets that can cater these services. But for now, on the outreach, we capacitate that when we are doing the cervical cancer screening, we also offer viral load testing, but also we give family planning services, but also we refer for those who are hypertensives to those clinics which are specialized so that they can have this comprehensive service. But also we cannot manage the HIV response without involving the primary health care system. As you can see in the facility that we support, more than 50% of our facilities are the dispensaries. So by this modality of having mentors who are government trained, we can be able to reach remote settings, hard to reach areas with knowledge, because all of us, we know that managing HIV needs comprehensive and quality services. So for these, I think we are going there, and we have modeled it, and we are sure that with the frosting environment that Dr. Albina already mentioned, we are going to reach where we want to go.
Thank you very much, Dr. Msimbe. Please give a big clap to Dr. Rehema Msimbe. Mr. Chirani, I think you agree with me that when you talk about HIV new infections, it is very impossible to ignore the youth group. I know you are a guru in designing and implementing the gender interventions. So can you tell us your experience in mainstreaming the gender and the youth interventions, specifically for sustaining the HIV epidemic control? Karibu.
Thank you for the good question. As you said, USAID Afya Yangu integrates gender, women empowerment, and youth inclusion as part of cross-cutting issues, especially across all program indicators, to ensure that all clients, especially women, girls, young people, and children, can enjoy their right to sexual and reproductive health, HIV, and TB services. So as a program, last year, actually, we conducted gender baseline assessment, which informed us some of the issues which facing, of course, our clients are facing And after these outcomes and results from this baseline assessment, then we developed the gender strategy. Of course, gender strategy focuses on three main gender transformative approaches, including promotion of adolescent and youth-friendly services, but also empowering women and girls, and engaging men as client, supportive partners, and agents of change. So to ensure that all these, of course, smooth implementation of this strategy and sustainability, so as a program, we embrace the peer-led programming. So through the peer-led program, as Dr. Rehema said, we are using peers, but also, and of course, empowering we didn't not create a new cadre from these peers, but we leveraged from the existing healthcare workers. So for the program, smooth implementation during last year, we supported more than 600 as a program CHWs, and of course among these, we had around 200 through the peer-led program. As Dr. We had mother champions, we have also male champions. So all these, of course, we are supporting them to conduct hotspot mapping, but also to conduct interpersonal communication sessions, for the program group discussions with their fellows. Dr. Emma said about SNS, social network programs. So we are using around peers to go around to their social networks to map the areas whereby we can go. Of course, we can support and provide services. Of course, we are supporting. Moving ahead, to especially to expand the provision of services, especially to young patients. We with their fellows. We are strengthening enhanced peer outreach and SNS, social networks. We will be supporting some of to go around healthcare workers and peer champions to ensure that whereby they will be conducting a kind of micromanagement to their fellow peers. Moving ahead, ensure that whenever the program the provision of services, especially to young people, some of these healthcare workers and peer champions will be providing a kind of technical support. All these peer champions supporting some CHWs are co-managed by the peer champions, but ensure that whereby with the aid from the CSOs, on women empowerment, and of course women and girls empowerment specifically, we are addressing gender-based violence, VAC, and intimate healthcare workers, and we integrate this throughout the kind of technical support during pre-initiation, care implementation, but also at city, of course, at in the life. So what we are doing as a program, we are supporting, of course, we are creating supportive environment to healthcare workers. So for instance, we trained around 300 healthcare workers throughout the program. But to ensure sustainability, we supported also healthcare workers from the higher level, higher one what we are doing facilities to go around the lower level facilities to provide mentorship program, especially to capacitate some of these healthcare workers from lower level facilities, especially on the areas of provision of GBV screening and provision of first-line support. So these are among the issues we are trying to integrate to ensure that from the higher level, especially these are our beneficiaries can enjoy their right to services and to ensure sustainable continuation of these interventions. So as a program from lower level supporting communities, especially on the CSO vision, of course, and RNCGBTs to ensure that they are conducting. So these are among sustainable communities we are trying to integrate to ensure that HIV services. So what we are doing, our beneficiaries, we train, we support training services, and to ensure sustainable, because our RNC continuation, but also we supported training interventions. So as a program, these during last year, they were able to conduct CSO like 12 GBTs to ensure that communities are conducting, whereby we brought together trying to integrate religious HIV services. So what the beneficiaries, our beneficiaries, which and they came together, we supported training services, the issues, but also to discuss how best these services can be improved. So they were able, for this, we expect like that, we will be having sustainability of the program, whereby, but also we will we are assuring that the youth, men, and the boys will have opportunity to exercise their rights and of course increase the performance and increase the service uptake. Thank you.
Thank you very much, Mr. Ryan. Can you give a clap, please? Mr. Rani, can you come again? The audience want to know. I want to know. Once you are dealing with the community, there might be some difficulties. Can you tell us the challenges? Thank you very much, Mr. Ryan. Can you give a clap, please? Mr. Rani, can you come again? The audience want to know. I want to know. Once you are dealing with the community, there might be some difficulties. Can you tell us the challenges? Thank you very much, Mr. Ryan. Can you give a clap, please? Mr. Rani, can you come again? The audience want to know.
Whenever they drop you, and we have collectively supported dealing with the community. So it's hard sometimes to cover that gap. So some of the youth, some of the issues, all the challenges we are facing.
Thank you very much. Thank you very much. Our next speaker will be Mr. Wangu. Mr. Wangu share with us experience of sustainable impact for all national integrated case management system for future generation in orphan and vulnerable children program. You're welcome. Thank you very much. Thank you very much. Our next speaker will be Mr. Wangu. Mr. Wangu share with us experience of sustainable impact for all national integrated case management system for future generation in orphan and vulnerable children program. You're welcome. Thank you very much. Thank you very much. Our next speaker will be Mr. Wangu. Mr. Wangu share with us experience of sustainable impact for all national integrated case management system for future generation in orphan and vulnerable children program. You're welcome. Thank you very much. Thank you very much. Our next speaker will be Mr. Wangu. Mr. Wangu share with us experience of sustainable impact for all national integrated case management system for future generation in orphan and vulnerable children. You're welcome. Thank you very much. Thank you very much. Our next speaker will be Mr. Wangu. Mr. Wangu
think of a child
share with us experience of sustainable impact for all national integrated case management system for future generation in orphan and vulnerable children.
HIV treatment, but also attain viral suppression. This is where education is being. So as Kizazi Hodari, we recognize the role of experience approach in ensuring that we are diverse and complex
national integrated case management system
for
future generation.
Nutrition services, their protection services, HIV treatment, but also attain viral suppression. And we do this where HIV inclusive case management approach that goes into medical community but also government volunteers who are based at the world table who are supporting in the future generation. And this approach is very sustainable and very effective. And we use it even but also to ensure that it is sustainable even after the end of the generation. And the project we did not reinvent the wheel. Rather, we utilize this government system called the national, but also government initiatives, harmonized, standardized, but also very systematic in ensuring care and protection is sustainable and very effective. And we use it even to ensure that this is sustainable educational services, to ensure that the children have all access of these services. And in the implementation of this, there are different levels. There is the national level up to the community level. Organized, but also very the initiatives approach care by monitoring the implementation of the government authorities to ensure that they are there at the standards, but also they support lower level to ensure that the children we also all access of these regional level. In the implementation of this, there are different levels. There is the national level up to the community level. Now organized to very the initiatives approach to their responsibility, monitoring the level of the government authorities to ensure that cadres are there implementing the intervention. Now, at the lower level, to ensure that national integrated case management, all of these supervisors who are now of these different levels of the management in the community level, supervised and organized system that to the initiative approach to the responsibility. Also, monitoring the level, community level, now government authorities to ensure that cadres are there implementing the intervention. Now, at lower level, to ensure that national these supervisors who are now of these different levels of the at the community level, we have the community case workers now to provide for these services, approach to the family level, linking, referring these kids and also the families now. These different levels have a very distinctive role in ensuring that the system is functional, but also services are provided as per staff. At the community level, we have the community case workers now to provide for these services, approach to the family level. Can you hear me now? No. Now, as Kizazi Hodari, we have heavily invested in the national integrated case implementation at the ward, at the community level, because this is where service delivery takes place. And also, we have now around more than 400 case management supervisors. We have more than 1,000 volunteers at the community level who are providing these services. Now, these supervisors plus the volunteers play a very positive role in coordinating and ensuring that there is implementation but service provision at the community and household level of the program. And through the system, but also through the use of
It's 1 minute to go.
Thank you. Through the use of the system, but also the volunteers, we've ensured that more than 90,000 beneficiaries have been saved, more than 40,000 beneficiaries have received nutritional services, and more than 30,000 beneficiaries have received level of the economic services. So that's a nutshell of the system, but also through the use of
It's 1 minute to go.
supporting the system, but also the volunteers, we've ensured that more than
Please give a clap to Mr. Yangu. Once again, give a clap to Mr. Yangu.
services and more than 30,000
Thank you very much. And we are all aware that Kizazi Hodari Zone, we are doing a good job. The last speaker is Dr. Frank, who is a Council Medical Officer from please give a clap to Mr. Yangu, District Council. Once again, give a clap to Mr. Well experienced in thank you very much, especially in the area of maternal. We are all aware that Kizazi Hodari, actually last year he created a good job. The last software, Dr. Frank, which has been used to reduce the number of maternal deaths. Please give a clap to Mr. Yangu. So once again, give a clap to so well experienced. Can you please tell us your experience engaging with the community? Actually, last year he created as one of the innovations in the HIV/AIDS which has been used to cancer
you are
juice,
welcome, please.
the number of maternal
Please
babies.
give a
there.
clap to Mr. Wangu.
So once again,
you.
is
So, good afternoon.
well. Can you please tell us your
experience
engaging with the community? It was last year you created as one of the innovation against HIV/AIDS, which responds to cancer juice, the number of maternal
Please
babies.
give a clap to Mr. Wangu.
So once again, is
So,
well. Can you please tell us your experience engaging with the community?
what we have seen,
It was last year you created
challenges
as one of the innovation against HIV/AIDS, which responds to cancer juice, the number of maternal
Please
babies.
give a clap to Mr. Wangu.
So what we did
is
we've seen that this local leaders,
can you please tell us your experience?
so what we do,
engaging with
we've completed a pronouncing
last year
whereby
you created
everybody who is
as one of the innovation against
and
HIV/AIDS,
being involved,
which
for
responds
example,
to cancer
people,
juice,
local leaders,
the number of maternal
all
babies.
farmers, all industries, all agriculture activities around there, this local so that they come together
Please
and
tell
have
us
activities.
your experience.
So through this activity, then we introduce, we completed programs which is everybody that is what you can see
one of the innovation
there. All health activities being on one area, and we do in the area where there is challenges in how they can farmers, those all industries or agriculture activities around. For example, so that they come together to have so through this activity, we completed programs provided every test that is what you can also all the health activities on one Afya, I mean, nutrition programs, nutrition programs. Also, we had all TB programs and also dumps. But mostly on the HIV, people had much involved HIV. That's on one area. Village also called all village health and nutrition activities. I mean, whereby here all villages also we had involved, and it's done only and also once a day. But mostly on the age and where every village around the involved HIV. So what is done on this one executive officers called all they have to find out on how they educate farmers and they can get products which can be used during the activities, and it's done only the activities once a day, mainly based on age, cooking every village, and also practicing about. So what is done breastfeeding this one, but as HMT we join their efforts on how we get some farmers medicine and products which can be free for them during also some of the laboratory activities, mainly diagnostics which can be free for them, but we mainly target on the thing about so what is this pregnant women and breastfeeding under 5. That's where we try to join to educate them on issues about HIV and how they can use them. They can also get some of the HIV acquired HIV and how they can prevent HIV diagnostics which can be for them. The key area here is also thing about so what is this pregnant women when you look on the 5, that's where we try to the productive educate them on issues. We have only 49 to 69%, but meaning that HIV about 30% or 40% we don't miss them. But when we involve them in the activity to the villages, we've seen that many women or women and their children, that's where coming to the press and we provide the good education. But later on, we have through the data when you go to the health facility where they will link them, you find that most of them they come during clinics, and those people who we had them during this activity, we've seen that village nutrition activity. That's what we do. There's nothing much on that. Provide but education. The areas that we need, you need them to. When we use
facility where the link partners. Meaning, when you have this success, during using the local clinics and also using the graduate workers, especially and also using the that's what we do. I mean, nothing much traditional Goma, but we need for media. I mean, those are the key areas that we tries to support our activities so that we can get a number of people. As you can see there, nothing like a lot of science. Just a simple thing that we are doing in the local areas to get those people and we involve them to traditional Goma.
Yeah, thank you very much, Dr. Frank. That was one of the wonderful experiences. I've seen once during the Village Health Nutrition Day that using that forum for the purpose of implementing, integrating various activities in the areas of HIV. Thank you very much, Dr. Frank. Thank you very much, one of the wonderful experience. We are going now to, I've seen one the session of questions the Village Health Nutrition Day. Before the audience, using that forum, Dr. Albina, for the purpose of implementing, I know you're aware that we are now integrating various activities in the areas of HIV. And thank you very much. In Lin region, thank you very much already engaged I've seen one session of possible challenges you expect. Before the audience, using that forum, Dr. Albina, for the purpose of implementing, I know you're aware that we are now integrating various activities in the areas of HIV. Can I use another mic? And thank you very much. In Lin region, thank you very much already engaged I've seen one session of possible challenges you expect.
Has resistance.
Before the audience, using that forum, Dr. Albina, for the purpose of, I know you're aware that we are now integrating various activities in the areas of HIV.
Their own body.
Thank you very much. In Lin region, thank you very much already.
But also we have challenges, limited resources,
possible challenges you expect.
As resistance from health facility, cancer regions, and national clergy.
For the
We also have a lot of challenges with human resource for health management because reliance, some of all funding support human resource for their own body. So once the project ends,
thank you very much already.
but also we have resources. So I see two main challenges: limited mindset and resistance you expect. As resistance from health.
Thank you very much. Please, can you give a clap to the panelists? So it's now the time for questions and answers. Welcome. Should we start that left side and then the right side? Raise your hand. So one. Thank you very much. Karibu. Please, can you give a clap to the panelists? So it's now the time for questions and answers. Welcome. Should we start? You can use another left side and then the right side. Raise your hand. So one. Thank you very much. Karibu. Please, can you give a clap to the panelists? So it's now the time for questions.
Thank you. My name is Dr. Godfrey. I work for CSSC. I want to congratulate Deloitte and the team for great work that they are doing. So I had a few questions. When we talk about sustainable HIV response, the first thing that comes to me is building systems. So I just wanted to know the role of Afya Yangu Southern Zone. I mean,
so it's now the time
Southern Zone and Kizazi Hodari. Thank you. My name is building the systems. just looking on the few aspects of systems, for example, leadership and governance. I've been to high volume PEPFAR sites where at CTC you find there's a very good documentation, proper management of clients and adherence to the standards and guidelines. But you go to the rest of the facility, it's quite the opposite. So the CTCs are like the foreign countries, right? So for me, like when you're trying to make a sustainable HIV response, this should be across the whole facilities in the general services as well. Because CTC in charges are well capacitated and they can really ensure everything is in place. But in some cases, even the facility managers are not aware of the good things that are going on at the CTCs. So foreign countries, right? As the program, how are we? For me, like when you're linking this, the general services and the general awareness across we did for instance, clinical audit in some of the facilities. Proper documentation, well capacity, less than 28%, is very poor in terms of in some cases even. But you go to CTC 100% everything. So this is not shared across the facility. So even beginning at the facility itself, I think program how we see or how we can integrate this good innovation and the general awareness that CTC we did with the general clinical audit in some of the. I think I know someone there talked about proper documentation, one-stop say less than 28. Why can't we make other clinics also? Why is the patient going for diabetes? CTC 100%, they're not getting HIV services, they are not necessary. So even beginning at the facility to reduce and offload this CTC, or be like any integrate this. Also the issue of finance. I just wanted to know how are the councils really committed to scale up innovations. Proper Dr. Frank talked about good innovation. Why can't we make other clinics? But in terms of financing, how much currently is being budgeted from the local resources? So even beginning at to go to HIV services and offload to fund innovations like those. Also the issue of finance. I just wanted to know, I think there's a lot still to do, as you say, mindset change. Not every HIV client is poor, cannot afford to pay for services. But why are we taking that all HIV clients should get a free service? When are we starting local? So for me, when we talk about sustainable HIV response, is it really a dream that will come true, or is it far away from coming true? Because we have to start now doing it and see that things are possible. It's possible for some clients to pay for HIV services. Not every HIV client. It's possible for the councils, for the hospitals to budget. Why are we taking HIV activity? Otherwise, I think it will still be highly dependent on IPs and the development. When we talk about sustainable HIV response, is this really a dream that will come true, or is it far away from coming true? Because we have to start now doing it and see that things are possible. It's possible for some clients to pay for HIV services. Not every HIV client. It's possible for the councils, for the hospitals to budget. Why are we taking HIV activity? Otherwise, I think it will still be highly dependent on IPs and the development. When we talk about sustainable HIV response,
I would like
to that will come true, or is it far away from coming true? Because we have to start now doing it and see that things are possible. It's possible for some clients to pay for HIV services. Not every HIV client. It's possible for the councils, for the hospitals to budget. Why are we taking HIV activity? Otherwise, I think it will still be highly dependent on IPs and the development.
When you are presenting legislation that are using corridors program, and whether you are engaging mention other information which level
Thank you very much. Yes, move to in front here. The face.
when you are presenting legislation that are using Hodari program, and whether you should engage in information others, information which level
Thank you very much. Yes, move to in front here, the FSA.
When you are presenting legislation that using Hodari program, and whether you should engage in information others, information
Thank you very much. Thank you very much, Dr. Afya. Yes. Move to in front of the FSA. Now let us move to the right side. Any questions from the right side? This side? At the back side?
Thank you very much, Deloitte and USAID for.
Thank you very much, Dr. Afya.
Congratulations to the panelists for nice discussion. I am Dr. Ansbit Gakingira from.
Any questions from the right?
I was trying to see how can we sustain HIV response for healthier lives in thriving communities if we are not going to integrate HIV response with. Thank you very much. Non-communicable burden for which.
Thank you very much, Dr. Afya.
And panelists for some of the discussion. Partners, they've started integrating by capacitating the healthcare workers with skills and knowledge on how they can screen, how they can prevent NCDs among people living with HIV/AIDS. Because with HIV response, there are researchers which show that burden for people living with HIV/AIDS. They are also having a burden compared to the normal population. They've started of NCDs because of ART, HIV inflammatory responses. So, however, to have a sustainable response without how they can, or if you are not going to integrate, prevent NCDs among people living with HIV.
Thank you very much, Doctor.
Because with HIV response, there are researchers which show that
yes,
for people living with HIV/AIDS. They are also having a burden compared to the normal population. They've started of NCDs because of ART, HIV inflammatory responses.
Thank you.
So, however, to have a sustainable response without or if you are not going to integrate, prevent NCDs among people living with HIV.
Thank you very much, Doctor.
I want to first congratulate presenters.
Thank you very much. HIV/AIDS. They are also having a burden,
but knowing we actually lack a big funding for two different topics, and I want to say this was thank you. There are lessons being learned actually for this B1 project, and this is also kind of reflection and feedback to the I want to first congratulate formally donor the work especially but knowing there are many lessons which for moving forward will inform better programming. There are lessons in order to also be able to implement actually the gains you get in the B1 project. There are lessons for this kind of new work which I want to share formally the work especially.
Thank you very much, Doctor. I think we have now 5 questions. That one will be the last.
Moving forward, will inform better programming.
Asante,
from the gains you get in the B1 project. There are lessons for this new work.
The projects are nice work that you are seeing. We are appreciating.
Thank you very much.
Based on
I think we have now
that you are
5 questions.
Sustaining this HIV response, and the matter like it was visited integrating something other services in HIV, services like family planning, nutrition, maybe the other probably non-communicable diseases. Projects. My question is, stigma is still an issue. Probably that's why these HIV services that we provided at a separate sustaining this is not less general PD than the matter like it was visited integrating something matter sustaining. You may even think about providing the services family planning. The general OPD that if a clinician or a nurse is seeing other regular patients and HIV patient comes there, stigma is still an issue. Providing the consultation, probably that's why general patient rooms that with not telling the patient this is not less general. So my question is, do we see this to be even think about providing the services family planning? General OPD.
Thank you very much. We have now 6 questions. I think it's time now to hear the answers from the panelists. Dr. Albina, can you please respond to the first question? And Dr. Rehema, please prepare to respond to. Thank you very much. The second, now 6 questions. The fifth, I think it's time now to hear the second, fourth, and fifth panelists.
Asante. So the question number 1 was the role of
Dr. Albina, can you please respond to the first question? And Dr. Rehema, please prepare to respond to. Thank you very much. The second, now 6 questions. The fifth, I think it's time now to hear the second, fourth, and fifth panelists.
most of the time, the question number 1, when they visit the facilities,
Albina, can you please respond to the
from
first
the
question?
regional RMO mentioned
And Dr. Rehema, please prepare to respond
then
to.
at the
Thank you very much.
facility, we
The
start
second,
the facility
now
in
6
charge.
questions. The
We
fifth,
tell them what are we going
I
to
think
do,
it's
what are we
time now to hear the
So
second,
these
fourth, and
facility
fifth
in charges
panelists.
are involved, but sometimes they are not aware. So you are right. Some of the facility in charges are not aware of
Albina,
the
can you please respond?
we take that positively in involving all of them
Dr. Rehema,
from the planning,
please prepare to respond.
coordination,
Thank you very much. The
facility,
second, now
activities,
6
also
questions.
stakeholder
The fifth,
engagement, like I said before, you have to do stakeholder engagement.
second,
So
fourth,
this starts
and
from
fifth
leadership of the facility, service providers, and the client. Some of the facilities. Another thing is for capacity development. We are building capacity so that in involving facility in charge of them from the planning to make sure that they are able to manage resources, both financial, also stakeholder engagement. Another one is strengthening or capacitating financial management leadership, like now the facilities are doing and owning their own fund clients. So by capacitating the financial system of the development, we are building capacity so that in facility in charge of them. So involving the leaders to make sure that even in documentation, if you capacitate the facility in charge, also stakeholder provision, if they know about it, next morning in the morning financial management, they have to ask about it. They follow it up. So we take it very positively and we are doing that. We have the financial at the capacity of making sure that if the project ends, the facility in charges are able to manage all the resources and they are able to sustain all the activities that we are done. They know about it.
Thank you very much. Dr. Rehema, hold on, please. The question number 2 goes to Mr. Rehani. There was an issue of community engagement, community mobilization. The question was about, you explained a lot on other groups when you talk about integration, engagement of the community. Thank you very much. You didn't exactly tell us about other groups. Like the question number 2 goes to some information. There was an issue of community engagement, people who expect to hear the rumors from the village, from the wards, etc. Can you explain a lot on other groups when you talk about integration? Engagement
for
of the
this
community.
question.
Thank you very much.
And as I indicated during my presentation, the program we should to embrace peer-led development. So those peers, some of these peers,
people who expect to hear the rumors,
and we are working
from the
also
village,
with
wards,
local radio
etc.
programs,
Can you
whereby
explain
they support us to create demand, and of
other
course
groups,
they engage these
when you talk
local
about
influencers
integration?
to ensure that they mobilize the
engagement
groups,
of the
and
community.
of course they help the program to reach the remote areas. So for example, some areas which has so many clients like men and the like. We are working with local influencers, but also we are using peers themselves, but also we are working with radio programs, local influencers, and of course local radio programs. They mobilize the groups, and of
Dr. Emma, now
course they help the program to reach the remote areas. So for example, some areas which has so many clients like men and the like. So local influencers, but also we are using peers themselves, but also we are working with radio programs, local influencers, and of course local radio programs. They mobilize the groups, and of
Dr. Emma, now
course they help the program to reach the remote areas. So for example, some areas which has so many clients like men and the like. So local influencers, but also we are using peers themselves, but also we are working with radio programs, local influencers, and of course local radio programs. They mobilize the groups, and of
Dr. Emma, now
they help the program to reach the remote areas. So for example, some areas which has so many clients like men and the like. So
we are sure that the same
local influencers, but also we are using peers themselves, but also we are working with radio programs, local influencers, and of course local radio
by
programs.
using this, we are reaching
Dr. Emma, now
all providers because previously we were non-eligible providers from citizens training but now we are sure that the same so that we are giving more providers robust knowledge to manage this. So looking forward is we are reaching all providers to foster provision of their services that non-eligible provided citizens but being capacitated to be provided and now making clear but also general and we have seen this is working. But also we are engaging the district medical officers looking for HCOs and HMTs in all the services that we provide, all new intervention and innovation which comes provided at clinics, treatment clinics, but we get provided and they supervise the provision of services at all areas and facilities. So since they are engaged and aware, but also we are engaging the district, we are working with them hand in hand from planning when we are in HCTs. It's something that is happening and it is in the rise, like one of the innovations which comes participant here asks, are we integrating non-communicable diseases? I think the prevention of disease, but we say we are screening. So since we are engaged and aware, and also we are in the rise, we are working with them hand in hand from planning, above attended our clinics, something that is happening in veterinary rise, like one of the. So for that, we do successful we in management, some of the beyond capacity that the clinic mentioned, but today the hypertensive clinic specialists, cardiologists who are at the different hospitals is the right we are working clients. But I think we should look closely at the issue of stigma. Yes, stigma is still there, but since at one-stop shop at the management, we think that the stigma which were, it's not like how we are now. We have really made advancement in our country. So we acknowledge that, but more integration, people should look more closely at the clinic. The issue of stigma, they know, yes, maybe somebody is going just for survival, but screening of family planning, top show for anti-hypertensive, think that the stigma other nationally were cancer, not like screening. So I think by this integration, the advancement in our country, so to leverage, acknowledge that, but more integration, people should look closely at the clinic. How are we working together? Yes, model that somebody is going just for survival in the southern program. We pass over some of the issues for retention, the client screening. So I think by this pediatrics are not in care, lost in care. So we pass over the acknowledge that they can trace these clients. They can closely what are they, what is happening. They look at the comprehensive approach at the community. So for us at the clinic, we see those clients over some of the issues continuing well in services like they have other areas. By this pediatrics are not in care. So the Kizazi Hodari will pass over that, but they can collaborate very closely. They can closely what are they, what is happening. They look at the comprehensive approach at the supported. So for us at the comprehensive, we see those clients support some of the we work very closely continuing well with services. Thank you.
Yeah, thank you very much, Dr. Rema, for clear illustration. Karibu Kizazi Hodari.
Asante sana. As Dr. Rema has said, our collaboration begins from the initiation stage, where we collaborate with Afya Yangu to ensure that we get the right beneficiaries who are HIV positive to be enrolled in the ODC program.
Yeah, thank you very much, Dr. Rema, for clear illustration. Karibu Kizazi Hodari.
Who are HIV positive are enrolled in the ODC program to get our collaboration services we are providing. So that is where our initiation stage, where during that process we try to monitor right adherence, whereby whenever there is clients who are defaulting enrolled in the Afya Yangu.
Yeah, thank you very much, Dr. Rema, for clear illustration. Karibu Kizazi Hodari.
But on top of that, I want to talk about the duty that collaboration services one of the resources were asked. It was our initiation stage. How do we during that process we monitor Hodari Southern whenever there is we are clients who are defaulting. Therefore,
yeah, thank you very much, Dr. Rema, for clear illustration.
Supervisors at the ward level with the knowledge and capacity that I want to monitor and supervise, but also ensure the community volunteers delivering the services during this process.
Thank you very much, Mr. Wangu. Just to wind up, Dr. Frank, there was an issue of clear illustration. The journey towards sustainability. The issue was about how so far the council is ready for the challenge. So, can you respond, please?
Yes.
Thank you very much, Mr. Wangu.
May I respond?
Just to wind up,
thank you for
Dr. Frank, there was an issue.
We have 3 areas
the journey towards
sustainability which we anticipate
the issue was
that could be a challenge.
How
one of the challenges is
council is ready for the challenge.
which is the council is led through SHP. When we make funds through health promotion, yes,
thank you very much, Mr.
a lot of
Wangu.
money for that.
Just to wind
But the
up,
other area is
friend,
the nutrition
there
issue.
was an issue.
We have
agenda.
three
So
areas
through
village health which education day
the
is
issue
1,000 per each.
How
One of the head, one of the challenge. So that's meaning that
ready for
let's say in Njombe district, which is the council, we have 18. We make funds. 18,000 children, yes, of which that means equivalent to around 20 million per year. So we look on there on some of the activities which are used at the village level. There is one to integrate HIV or AIDS services. So that's meaning also the other area is in every event we have there must be a dead. There should be over there 18,000 children, of which dead participated well in that area. That meaning if you have a district effective election, meaning that all the CMTs will be over there. Some of the activities which are because this activity involves also schools to integrate schools which are around over there, and also those other areas. Meaning everywhere in the world so when you involve the 18,000 students, any challenge then share well CMTs. So meaning here we can see there is your district meaning so all the CMT education officers over there, both primary and secondary schools. This activity involves also schools to integrate, getting over there, trying to get also those funds. We have to involve all retail orders and also the CMT as well. So, but also when there is a challenge on any challenge is shared technical CMTs. Let's say so meaning we are related to your services over there, but there are things like CMTs which need specialists. So when we start using this, when we start doing this event, we have to involve also the RRI, trying to get also those meaning have to involve all the regional referral hospitals, CMT. So in this event also, but also when there is a challenge to combat all the issues on the technical aspects. So meaning we are related to your services over there.
Thank you very much, Dr. Frank. And this is the end of our panelists. Can you please give a big clap to them? Once more. Thank you very much. You can move back to a seat. We have very few minutes before we close up. And before we close, thank you very much to call upon. And this is the Chief of Park Kizazi Hodari. Can you please give a big clap to Matoyo? Please clap for once more, in 1 minute. Give us a closing remark. You can move back to a seat. We have very few minutes before we close up.
First of all.
And before we close, thank you very much to call upon. And this is the Chief of Park.
We appreciate your
Can you please give a big clap to
as well as the question which actually
once more, in 1 minute. Give us a closing remark.
Have taken into considerations most of the
We have
questions raised
very
for us are
few
important.
minutes before we
But also would like to appreciate
before we
the
call,
presence
thank you
of
very
your
much
team in here, and
this
we
is
really
Chief
appreciate your support. And we as Deloitte, I can say we are very much conscious, committed to ensure that we work with the government and with the partners in our region to design and implement interventions which will bring impact to the community considerations. But also we are looking forward to interventions which will then also lay by the end of these two programs what will happen, what are we leaving behind. And this is what, and we really appreciate. And we hope our panelists will be able just to share a few of the many interventions which we have. And we are likely to have our member from other GMT Jombe sign and work together to have all these valuable interventions implemented in a very systematic way and put in the sustainability. Thank you so much. Lastly, before before I wind up, as you know, Deloitte is implementing two major programs, Afya Yangu and Kizazi Hodari. There was a question from one of the delegates on how many intervention programs can be one. And for us, we say that to have programs is a demonstration that if you have a program, a community and facility program in one organization, the impact will be, because all that has been demonstrated both in Afya Yangu and Kizazi Hodari, because of us being in one house, sharing data, resources, and to the point that it's easy to implement the program. And for us, so much that to have a nice day. It's a demonstration that if you have a program, a community and facility program.
Thank you very much, Chief of Part, please hold on. Please hold on. Now we are going to have a group photo.
Resources and to the point that
the group will be 4, and the first group will be.
Before you leave, there are some.
Thank you very much, Chief of Part. Please hold on. Please hold on. Now we are going to have a group photo. The group will be 4, and the first group will be.
Before you leave, if you don't have your badge,
thank you very much.
Please, maybe you have not registered.
Chief of Part.
Just upstairs, there will be someone who will be able to assist.
Please hold on.
Okay, now
please hold on. Now we are going to have a group photo. Before the group photo, may I please appreciate the presence of Zahara Mems engagement. Can you stand up and wave to the audience?
Maybe you have not registered.
Chief of Part.
Just upstairs, there will be someone who will be able to
Asante sana. Now, Meko USAID Afya Yangu all staff before the group photo stand back of the seats. Appreciate the presence of USAID team, Zahara Mems, the government officials engagement. Will you please come forward? Dr. Kingia, I saw you moving outside. You are welcome. Asante sana. USAID Afya Yangu, Kizazi Hodari, USAID Afya Yangu, USAID team, the government officials. Please move forward. Have a seat there. And USAID team, Zahara Mems, the government officials engagement. Will you please come forward? Dr. Kingia, I saw you moving outside. You are welcome. Asante sana. USAID Afya Yangu, Kizazi Hodari, USAID Afya Yangu, USAID team, the government officials. Please move forward. Have a seat there. And USAID team, Zahara Mems, the government officials engagement. Will you please come forward? Dr. Kingia, I saw you moving outside. You are welcome. Asante sana. USAID Afya Yangu, Kizazi Hodari, USAID Afya Yangu, USAID team, the government officials. Please move forward. Have a seat there. And USAID team, Zahara Mems, the government officials engagement. Will you please come forward? Dr. Kingia, I saw you moving outside. You are welcome. Asante sana. USAID Afya Yangu, Kizazi Hodari, USAID Afya Yangu, USAID team, the government officials. Please move forward.